Frontalis muscle covers the frontal bone. So this is a frontalis muscle right here. You have the facial vein. If we blow it up large enough, you'll see this little vein running right here. That's your facial vein. Okay. Zygomaticus major connects the mouth or the lips to the zygomatic bone. That's your cheekbone. Okay. There's a zygomaticus major and a zygomaticus minor. Okay. The major is below the zygomaticus minor when you look at it. You see the parotid duct, which connects the parotid gland to the intraoral cavity. Okay. When the parotid gland secretes its secretion, it travels through the parotid duct and then enters into the oral cavity. Okay. Trapezius muscle is a large trapezoid-shaped muscle on the back, wraps over around the neck. And there's your trapezius muscle. It's the attachment of the anterior portion of the trapezius muscle. Platysma, the platysma is this huge neck muscle right here. It extends all across the neck. Okay, that's your platysma muscle. You see that huge muscle right there. Depressor anguli oris. Oris is the mouth. Okay, depressor means pull down at an angle. So the depressor anguli oris pulls down the angles or the angles of that form of the mouth. And the orbicularis oris, orbicularis means circular. Oris means mouth. Orbicularis is the circular muscle around the mouth. So far, so good. I didn't freeze up yet, right? Still going good?
Yeah, you're still going.
All right, thanks. A little bit deeper here. Again, see the frontalis muscle. And if you highlight it, it'll show exactly where it is. And you can review these anytime you want. Just go to the study area and you have all this information for you. So there's the frontalis muscle. There's the orbicularis oculi. Remember, orbicularis is round, oculi is eye, oris is mouth. So orbicularis oculi is a circular muscle around the eye. Orbicularis oris is a circular muscle around the mouth. Okay. So the orbicularis oculi, orbicularis oris. Depressor anguli oris, we talked about last time. Same one right there. The mylohyoid connects the hyoid bone to the mandible. Remember, the hyoid bone sits below the mandible, and it's a free-floating bone. Has no articulations with any other bone. Okay, it's the only bone, I believe it's the only bone in the human body like that, has no articulations at all. It's just free-floating. The scaling muscles of the neck, the sternohyoid, connect the sternum, okay, to the hyoid bone. Clavicle or collarbone. Okay. The omohyoid muscle. Okay, the strap muscle. You have a digastric anterior belly. The posterior belly runs behind it. You can't, it's deep to that. This is a digastric anterior belly. You have the submandibular gland. You can see it's glandular tissue. If we blow it up, let's take the marks off of it there. Mentalis, there we go. And you can see how it's glandular tissue right in this area here. All surrounding that is all glandular tissue right here. Okay, you can see it's different than muscle or tissue. So that's your submandibular gland, the gland that secretes saliva that sits under the mandible. Mentalis muscle is the muscle at the tip of your chin. Okay, the mentalis point there. And the depressor labii inferioris depresses the lower lip. So those are the depressor labii inferioris ossa, and the other one is depressor anguli oris. See the angle they pull down at? Depressor labii pulls straight down. Okay, lateral view of the head and neck. Orbicularis oculi, the circular muscle around the eye. The zygomaticus major connects the zygomatic bone to the corner of the mouth. The masseter muscle, your main muscle of mastication. You see it's still underneath the parotid gland. You can't see a lot of it, but it swings down below that, connects the mandible to the temporal bone. And orbicularis oris, the circular muscle around the mouth. Depressor anguli oris, okay, depresses the mouth at an angle. The platysma is that huge neck muscle. Can't miss that one. That one's gigantic, okay? That's all the platysma. Around the entire neck coming straight down. Sternocleidomastoid, again, 3 heads of that muscle. Okay, connects to the mastoid process, connects to the sternum, and connects to the clavicle. The parotid gland, again, if you look at the parotid gland, let's blow this up without getting that blue stuff in the way. Let's use your neck muscle. And you can see the glandular tissue. See all this tissue right around here. This is all glandular tissue. It's all different than muscle. Okay, see how it looks different? It's all glandular, it's all bumps. That's your parotid gland. It's the largest gland in the body is a parotid gland. It's huge. Okay, and then the duct travels right here. That's a parotid duct. Okay, comes here, enters into the back of the oral cavity just above the second molar, called Wharton's duct or the parotid duct. Okay, and it's what's responsible for depositing calculus on the back of your teeth. That's what we scrape off with the hygienist, because all that salivary stuff sticks to the teeth and causes calculus to build up. And we see it by the submandibular gland, and we see it by the parotid gland, where the ducts enter into the oral cavity. Occipitalis is a muscle on the occipital bone. Frontalis is a muscle on the frontal bone. There's your occipitalis, there's your frontalis. Okay, going a little bit deeper, we go through there. Now you can see your masseter a little bit better. We'll take the blue stuff, the blue edge off. You can see the masseter right in the middle of the screen right there. Okay, it's a huge muscle, slings under the mandible, comes into the zygomatic arch. Is it one of your main muscles of mastication? That and the temporalis muscle. Again, your parotid duct. Okay, feeds off the parotid gland. You can see how big the parotid gland is. You see the difference between glandular tissue and muscle tissue. So parotid gland, parotid duct, submandibular gland. Again, that's a gland below the mandible. Digastric muscle. Okay. It's a strap muscle. Omohyoid, the superior belly of it. There's also an inferior belly of it. That's the omohyoid. Then the sternohyoid muscle. Connects the hyoid bone to the sternum. There's your clavicle, your collarbone. Your levator scapulae. Your external jugular vein. Again, you see the difference between veins, glandular tissue, and muscles. So there's your external jugular vein. Your sternocleidomastoid, your parotid gland, and your temporalis muscle. This temporalis muscle feeds down under the mandible, down deep. Okay, a little bit deeper. It shows the mandible being cut away here. Okay, as they cut it out of the way so you can see underneath it. Remember, you have your lateral pterygoids and your medial pterygoids. Those connect to the temporomandibular joint. They control the movement of sideways motions of your jawbone as you open and close. So your lateral pterygoids and your medial pterygoids. Lateral pterygoids are lateral, away from the midline. Your medial pterygoids is closer to the midline on the body. Okay. The digastric muscle again. Your omohyoid, the superior belly. And behind that, you have your omohyoid inferior belly. There's the inferior belly, the omohyoid. Okay. And there's the sternohyoid muscle again. And you have scalenes. You have a posterior scalene, one's towards the back. You have a middle scalene and the anterior scalene. That's your posterior scalene right there. Internal jugular vein again. Your middle scalene. Your levator scapulae. and your splenius capitis, the back of the behind the ear. All right. Again, the digastric posterior belly, you can see, and the digastric anterior belly. You can see the anterior belly right here in blue, and it slings through up around the back to the digastric posterior belly. You got your styloid hyoid muscle still, side view of it there. You got your omohyoid muscle, and you got the anterior scalene. Remember, we had the middle scalene, the posterior scalenes. Oh, you still got it here. This is the anterior scalene, it's highlighted in blue. Then distal to that or posterior, you have the middle scalene. And then posterior to that, you have your posterior scalene. Those are the neck muscles. So your anterior scalene, middle scalene, posterior scalene. Okay. The levator scapulae muscle. You can see where that's located. And the splenius capitis is muscle of the skull cap behind the ear. Is your splenius capitis. Oops. Okay, a back view, posterior view. Epicranial aponeuroses. What does aponeuroses mean?
Attaches muscle to muscle.
Perfect. Aponeuroses attach muscle to muscle. Tendons connect muscle to bone. Ligaments connect bone to bone. So that's your aponeuroses. So the epicranial goes over the cranium. It connects the occipital to the frontal, the occipitalis muscle to the frontalis muscle. Is your epicranial aponeuroses, connecting muscle to muscle. Again, so this is going to, I'll go over the skull cap just like that. And on the back end here is your occipital. The frontal end toward the anterior portion is your frontalis. Okay. Your splenius capitis is the muscles behind the ear and back of the neck. Your sternocleidomastoid again. And the trapezius muscle. And the trapezius goes over the neck onto the anterior portion for a small bit. So that's the trapezius muscle. Shaped like a trapezoid on the lower part of your back. I'll go this way if that won't work. Okay. Again, occipitalis muscle. Okay. Your semispinalis capitis. Remember the capitis, the splenius capitis was a large muscle that around behind the ears and up. The semispinalis capitis is a smaller muscle in between those. You got the levator scapulae, splenius cervicus, iliocostalis muscle that extends down, and the spinalis muscle right down the spine. It extends down further, you just can't see in the picture. That's the tip of the spinalis muscle on both sides of the vertebral column. You have the longissimus muscle, lateral to that. And the supraspinatus muscle, okay? Above the clavicles. I know it's a lot of information just going through all these. And again, you can review my lecture notes or you can view this on Pearson. Okay. You have the obliquus superior, which is at an angle. Again, the longissimus muscle, lateral, medial to that, outside. You see how the length of that runs. The spinalis muscle runs down the spine in the vertebral column. Again, runs both sides of the vertebral column. That's the spinalis muscle. The supraspinatus muscle runs above the clavicles. The levator scapulae, the side of the neck. And the semispinalis capitis. That's in between the capitis muscles. The semispinalis capitis. And this is your obliquus. The obliquus capitis is superior, and a semispinatus capitis as it runs down the back to the spinal cord. Okay. Deep dissection in the back. You have the rectus capitis posterior major. You have the obliquus capitis inferior below that. You have the levator scapulae, the side of the neck, the semispinalis thoraxis, going down the thoracic part, going down the thoracic part of the vertebral column. So that's your semispinalis thoracics, semispinalis capitis, along the entire side, behind the ears. Cervicus runs in between those. And the obliquus capitis superior runs on top, and the rectus capitis posterior minor runs on top. So the rectus capitis posterior minor runs most superiorly, and the rectus capitis posterior major runs below that, runs inferior to it. So the minor is superior to the major muscle for the rectus capitis posterior. All right, things we talked about before here. This is the head view. You've got the frontalis muscle going across the entire frontal bone here. Again, it's connected to the occipital muscle, occipitalis, by the aponeurosis. Epicondral aponeurosis goes across the top of the skull. The orbicularis oculi is a circular muscle around the eye. Orbicularis oris is a circular muscle around the mouth. Depressor anguli oris pulls down and depresses the angles of the mouth. Depressor labii inferiors possesses the inferior border of the lips. And the mentalis muscle is right on the tip of the chin. So there's your frontalis muscle, orbicularis oculi, orbicularis oris, around the eyes, around the mouth. Facial artery, because it comes up, branches down here. You see the facial artery running up along the outside border of the ramus of the mandible. The mentalis muscle of the chin. Depressor labii inferioris depresses the labii, the lips on the inferior border. Depressor anguli oris depresses the angles of the mouth. Buccinator is your largest muscle of mastication, main muscle of mastication. I'm sorry, the buccinator runs, the masseter is the main muscle of mastication. I said that backwards, I'm sorry. The buccinator runs the sideways along the buccal folds, the sides of your cheek. That's your buccinator muscle. Allows you to blow the trumpet, clarinet, whatever instrument you're playing. It compresses the sides of the face from the mouth. The levator labii superioris and the levator labii superioris alique nase by the side of the nose. Okay, seems to have caught up now. The lateral view, frontalis muscle. Okay, the masseter muscle. You can see the masseter muscle there. That's the main muscle of mastication. That swings around from the zygomatic arch down to the angle, down below the angle of the mandible. Okay. Zygomaticus major. Remember how that runs. Orbicularis oris, around the eye, mouth, I'm sorry. The depressor labii inferioris, depressor anguli oris. And the platysma. That whole muscle is the platysma. The entire front of your neck is the platysma muscle. Then the sternocleidomastoid comes from the mastoid process, attaches to the sternum and to the clavicle. Here's a real good view of the parotid gland. You can see that. You can see it does not look like muscle tissue. There's your parotid gland. I'll take it off the blue stuff here. Okay. See the difference? See all this right here? That's all your parotid gland. It's not muscle. It's not right here. That's your parotid gland. It's glandular tissue. Largest salivary gland in the body. And you see the duct that feeds into it, and it feeds into the oral cavity just behind the second molar, or just buccal to or facial to the second molar. So there's a parotid duct. Okay. And your occipitalis muscle, your orbicularis oculi, and the epicranial aponeuroses. Okay. The aponeuroses, like Jonathan said, it connects muscle to muscle. This connects the frontalis muscle to the occipitalis muscle. And it goes over the cranium. So it's epicranial aponeuroses. So a lot of times you need to figure out by the name what it's doing, where it should be located. Let's see if we catch up here. Here we go. Again, this is a side view. So that's your frontalis muscle again. Your levator labii superioris alocate nasi, side of the nose. Okay. Levator labii superioris. Zygomaticus major. Depressor anguli oris. Again, this is a real good view of the masseter muscle here too. You can see this huge muscle. See, it runs from here to here, this whole thing. Okay. This is your masseter. This is underneath the parotid gland, the parotid duct. But that whole thing there, that's your masseter muscle. You see how thick and heavy that muscle is for mastication. Like I said, the average person can bite with a force of about 300 psi. Once you put dentures in there, the average person bites with 5 psi. So it's a big difference. I tell my patients, you don't want to lose teeth. Okay? Because when we replace them, you're not going to have the biting force. You're not going to have the taste buds that you normally have. So that's the masseter muscle. The external jugular vein, the sternocleidoid mastoid muscle, the digastric belly, the digastric posterior belly. You got your parotid duct and your parotid gland, and the occipitalis muscle, and the temporalis muscle. You can see some of the tough fibers of that temporalis muscle too. If you look at it that way, you can see those fibers all continue down and swings up and pulls on the mandible to force it shut. That's what causes migraines, is the temporalis muscle. Okay? So when you bite down and clench your teeth at night, you grind teeth together, what happens, those teeth have cusping grooves, they lock in place, and the temporalis muscle forces back and forth. That's what creates the migraine headaches when you wake up in the morning. Okay? So we make appliances that interrupt that force, and it tends to prevent the migraine from developing. It's not treatment for migraine, but it helps to prevent them from happening. Okay, a little bit deeper on the lateral view here. Again, orbicularis oculi. Levator labii superioris allocate nasi, that's one side of the nose. Levator labii superioris, zygomaticus major, depressor anguli oris. Now here you see the submandibular gland. You notice the tissue there. Okay? That's not muscle, it's tissue. You can see the difference. If I blow that up, you can see the gland right there perfectly. The submandibular gland. See the difference in muscle and the difference in muscle tissue and glandular tissue. You can see the difference. The splenius capitis, muscle runs in the back. The digastric muscle, the sternocleidomastoid, and the mandible. And again, your temporalis muscles you can see up on top. And a little bit deeper again. You got the temporalis muscle, okay, covering the entire temporal bone. You got your lateral pterygoid and your medial pterygoid. Your lateral pterygoid pulls to the side, the medial pterygoid pulls medial to it. Again, those are the ones that connect to the TMJ, and those allow your rotational movement of your jaw rather than just your masseter your temporalis allow a hinge up and down. Okay. And the medial and lateral pterygoids allow the mandible to swing side to side. Okay, there's your bucks here. There's your mandibular cut. That's the mandible and the cut portion, as you can see underneath it. Again, the submandibular gland. You can see the difference between glandular tissue and muscle tissue. Your internal jugular vein, your levator scapulae, your digastric muscle, your medial talked about, and the splenius capitis behind the ear along the back of the neck. You got one more cut that goes a little deeper. Okay. Again, the buccinator muscle. That's the muscle that runs on the side of the mouth that allows you to push your lips together, like a kissing motion, allows you to blow a trumpet, things like that. That's your buccinator muscle. The mylohyoid muscle. It connects the mandible to the hyoid bone. Depressor anguli oris, I talked about. The digastric anterior belly. And you have the digastric posterior belly too. This is your anterior belly right here. And it slings up into the posterior belly. Okay. There's your anterior belly of the gastric muscle. Omohyoid muscle again. the common carotid artery that branches off the aorta. We haven't gotten into the cardiovascular system, but we will. The levator scapulae, the stylohyoid muscle, and the posterior belly of the digastric muscle. That's the lateral view. Questions so far? Okay, so I can still check the chat group too. So if you have a question, you can chat, type it in there, or you can just ask me. All right, epicranial aponeuroses, we talked about several times, connecting the frontalis muscle to the occipitalis muscle. That's this huge area right here that goes over the scalp. Again, aponeuroses, muscle to muscle. Occipitalis muscle. The splenius capitis muscle we talked about. Trapezius muscle. Coming out the back, and the big trapezius, it comes over your shoulders, and then down the back in the shape of a trapezoid. And you see the sternocleidomastoid. Okay. Occipitalis muscle again, a little deeper dissection. The semispinalis capitis muscles, and the splenius capitis muscles. So the semispinalis capitis muscles are above or superior to the splenius capitis muscles. They're a bit longer, run down the neck. Okay. Again, the occipitalis muscle, the semispinalis capitis, semispinalis cervicis, the small muscles that run just on the side of the beginning of the spinal cord, longissimus muscle, and the oblique capitis superior muscle. Our muscles are in the posterior view of the skull. All right. The obliquus capitis superior, muscle up on the top there. Okay, you can see where that runs. And in between that muscle, you have the rectus capitis posterior minor, which runs along the top. Rectus capitis posterior major, which runs just below it. So just like the zygomatic muscle, the zygomatic is major and minor. The minor is superior to the major. Same with the rectus capitis posterior. The minor is superior to the major. Then you have your obliquus capitis inferior, below that. The semispinalis cervicis, where the smallest runs to the tip of the spine. You can split it on each side of the spine. The spinous process of C2, there's your second cervical spine. That's a transverse process of it. Semispinalis capitis runs along the side from the neck. And we already did the oblique capitis superior. All right, superficial muscles of the neck. There's one muscle of the neck. Now, everybody should get this one, right? It's the platysma. It's huge. It covers the entire frontal portion of your neck, and it just drapes over the entire body. This is one of the muscles you can't miss. This is the platysma, this whole thing. And this is a tendon of the sternocleidomastoid muscle that connects to the platysma muscle to the neck. Okay, we'll dissect a little bit deeper on that. Okay, below, take the platysma muscle off. Below it, you have the mylohyoid. Again, the hyoid bone is the only bone that does not articulate with any other bone of the human body. Okay, it's a free-floating bone. It's just connected by muscles to the mandible. There's a submandibular gland. Again, you should be able to tell now the difference between glandular tissue and muscular tissue. You should be able to see the difference. You can see how those glands are right there. You can see how this area here does not look like muscle tissue down here. That's your submandibular gland. That's where everything swells up when you get sick. Put your hand behind the angle of the mandible. There's your glands that start to swell up. But lymph nodes are right by the submandibular gland. You have your thyroid muscle. You have your sternohyoid muscle. And you got your sternothyroid muscle. Again, we have the digastric, the anterior belly you can see, posterior belly you can't see, it runs back behind it. You got the hyoid bone, non-articulating bone. The omohyoid, superior belly. Omohyoid, inferior belly. You can see it right here. This is the superior belly of it. And then it bends around and constricts right here. And this is your inferior belly of the omohyoid muscle. Okay, lateral view of the neck. Again, the platysma muscle is a huge muscle. Okay, covering the entire part of the neck. The angle presses the angles of the mouth. The splenius capitis muscle in the back. The trapezius muscle. This is the anterior attachment or over the shoulder. It comes up the base of the skull, the trapezius, and then wraps over the shoulder for a small portion of your anterior section of your body. So there's your trapezius attachment to the anterior portion. It goes over your shoulder. There's your deltoid muscle, which is the main muscle of abduction of the arm. The pectoralis major, the main muscle of adduction of the arm. Then the sternocleidoid mastoid muscle, as it runs under the platysma. Let's go down. Let's move the platysma here. Underneath the platysma, you can see the digastric muscle again. Okay, this is the anterior belly here, and this is the posterior belly here. You have your omohyoid muscle. You have your sternohyoid muscle. And there you can see the external jugular vein really well too. You can see as it runs across right here. This is your external jugular vein. That's where blood is returned back to the heart. The subclavius muscle, below the collarbone, below the clavicle. Your scalene muscles. Okay, you have an anterior, middle, and a posterior scalene muscles of the neck. The levator scapulae, and the sternocleidoid mastoid. Okay, going deeper. Now you can see the digastric muscle. You can see the anterior belly and the posterior belly. This is the digastric anterior belly right here, right there. And it slings around under the submandibular gland and it comes up. And this is the posterior belly right here. And this is your submandibular gland. This is the thyroid hyoid muscle. Your omohyoid. This is your superior belly. And it slings around, constricts right here, right at that point, and you get your posterior or inferior belly, I'm sorry. Get your anterior belly and your inferior belly of the omohyoid muscle. Okay. You have the thyroid muscle. You have your sternothyroid muscle. You have your sternohyoid muscle. And again, the internal jugular vein, this portion of it right here that comes up. You got your anterior scalene, you got your middle scalene, and you got your posterior scalene. Those are the three muscles on the side of the neck. Your anterior scalene, middle scalene, and posterior scalene. Again, the trapezius muscle extends up to the base of the skull by the occipital bone, and it wraps over the shoulder, over the towards the clavicle. Doesn't go to the clavicle, but wraps over your top of your shoulder and is on the anterior portion. And this is it right here, or the trapezius. And you can see part of the splenius capitis, which comes up the side of the neck behind the ear, and the levator scapulae. All right, let that catch up. And let's start with the mylohyoid muscle. You can see where that runs right here. You can see your digastric. This is the anterior belly. This is the posterior belly. This thing's around. So anterior belly of the digastric, posterior belly of the digastric. You have your sternohyoid muscle. You have your omohyoid. This is the superior belly. Comes around. There's your constriction point, and this is the inferior belly of the omohyoid muscle. And then between those, running deep to it, you have your sternothyroid muscle. And again, anterior scalenes, right there. Middle scalenes, and posterior scalenes. And coming up over towards the clavicle, over the distal portion by the scapula, is your trapezius muscle. That's your anterior connection to the trapezius muscle. On the side of the neck is the levator scapulae, the thyroid hyoid, the splenius capitis. Was the muscle on the side of the neck, remember? The splenius capitis. And again, the trapezius, the huge muscle here, comes up to the base of the skull, up towards the occipitalis muscle. That's connecting here, runs over, crosses over the top of the shoulder, over to the anterior section to connect, and then it runs down the vertebral column, making a large trapezoid shape. And then the sternocleidoid mastoid muscle you see on the side. So that's the splenius capitis, splenius cervicus, and the longissimus muscle runs down the length of the spinal cord. The spinalis muscles runs medial to those, the longissimus muscle. The infraspinatus runs to the outside, and the iliocostalis muscle, you'll see where those are located, and the supraspinatus, okay, runs above the clavicle bones over the back. And then the levator scapulae of the neck. This sometimes it takes a while to catch up on some of the slides. Okay, the supraspinatus capitis, see how long that muscle extends, and that's towards the midline. And then you have the semispinalis cervicus, which runs in between those. If I can get that to highlight right there. And then muscle extends down the sides of the spinal cord. That's longissimus muscle. Then the levator scapulae in the neck, and the obliquus capitis superior up by the top, up by the occipital bone. And one more slide on this one, and that takes care of the head and neck. Maybe. Let's do it this way. There you go. Okay, we talked about it a little bit before. The rectus capitis posterior minor and the rectus capitis posterior major. The minor is superior to the major. So here's your rectus capitis superior minor. Then below that, you have the rectus capitis posterior major. Okay. Then below that, you have the obliquus capitis inferior. Okay, then semispinalis cervicus muscles. And the semispinalis capitis runs lateral to those. And then extends up behind the ears. Levator scapulae, the muscles in the neck. This is a spinous process or the tip of the transverse process of C2 as it feeds back from the spinal cord. And then the muscle on the top, right by the occipital bone, is the obliquus capitis superior on both sides, on both edges there. All right. Let's see how we do on the quiz. Okay. What muscle is highlighted there? Anybody want to guess?
Anterior scalene.
Could be posterior scalene or the levator scapulae.
I was going to say the levator scapulae.
Okay. Like I said, there's a lot of muscles to know here. No, there's a posterior scalene. The levator scapulae just runs a little bit lateral. The levator scapulae should run right here. That's your posterior scalene. There's your middle scalene, and here's your anterior scalene. Okay. From this area, underneath the inferior belly of the digastric. Like I said, there's a lot of muscles here. Okay, which muscles are those on the back, on the posterior view of the head? What's that? There's two muscle groups here. This is the major. This is the minor. This is the major down below it.
The rectus
Capitis posterior.
Yeah.
Posterior. Major.
Major.
Yeah.
Right. The minor is anterior and major is inferior. Got it. Perfect. And the short.
These pictures creep me out.
It'd be good if we get real cadavers. Those are a lot more interesting. All right, so we got this muscle here. That's lateral to both all the scaling muscles. So which one would that be? That should be the one you said last time, Ashley.
The levator scapulae.
I think that's the levator scapulae. From what I can see there. Yep, perfect. Okay, the muscle on the side of the neck. Okay, what muscle is highlighted here? And that's a duplicate. So we should get this one right.
Rectus capitis posterior major.
Correct. Rectus capitis posterior major. You got it. It's nice when they ask two in a row, two of the same one. We should all get this one.
Frontalis.
Frontalis muscle. Like I said, I'm not going to hold you responsible for all the little, but you should know the major muscles. I mean, there's over 700 muscles. I don't have them all memorized. So I don't expect you guys to have them all memorized. But you got to remember, when you do your exams, you got an open book in front of you. So as long as you have good ideas of where to look for things, you'll do good. So if you study hard and know where things are, you can refresh yourself by going to the book. Don't depend on the book to give you all your answers. But know them in advance and know where to look, and you should do really well. So frontalis muscle. Perfect. This is just below the mandible. There's a hyoid bone right there. So that would be your what?
Thyrohyoid?
That could be the thyroid.
Isn't the omohyoid underneath it?
The omohyoid's underneath it. Thyroid's above it.
Then sternohyoid would be taking it to the sternum.
But it also could be the digastric belly as it comes across. But I think you're right. I think it's a thyroid. Nope, anterior belly digastric. Sometimes it's hard to tell. Okay, the thyroid is probably just below that one, or right here to the middle of it. But this one is the anterior belly, the digastric. Actually, on my exams, they'll be obvious of what I'm pointing to. Because some of these can be tough. All right. One muscle runs all the way up here and then connects down here. There's only one that runs that far.
Sternocleidomastoid.
Sternocleidomastoid. Comes with the mastoid process, runs all the way down and connects to the sternum and the clavicle. Okay. But you see what the platysma is, right? This is all platysma. This muscle runs underneath the platysma here. And that's the sternocleidomastoid muscle. You got it. Okay, what muscle is highlighted here?
Splenius capitis?
I would say the splenius capitis. Because your posterior scalene is close, but I think posterior scalene runs right here. And your levator scapulae is right this one right here. So I would say it's the splenius capitis. Perfect. Very good. Okay. It's not the duplicate only I did before. She ruled that one out. So this is the
Oblique capitis inferior.
oblique capitis inferior. Very good. Perfect. Okay. And these muscles here. It looks like it's just underneath this trapezius muscle right there. Levator scapulae runs in the neck.
Mm-hmm.
The infraspinatus, splenius capitis runs here. The supraspinatus muscle there. Any guesses?
Infraspinatus.
I'd say the infraspinatus. Perfect. Good guess. Got it. Number 11. Okay, we should all get this one too. We talked about that one enough. That one's not a muscle, right? That one connects two muscles. So what would that be?
Epicranial aponeuroses.
Epicranial aponeuroses. Just go by the name. Epicranial, covering the cranium. Aponeuroses connects muscle to muscle. Okay. That's a very thin muscle. This is one belly of it. This is the second belly down here because there's your constriction point. So what muscle would that be?
Omohyoid superior belly.
Omohyoid superior belly. Got it. Okay, looking at that one, that is the
Occipitalis.
Occipitalis, it's the side view of it. Yep. Occipitalis muscle. This would be the one that's most medial along the spinal cord.
Not
Not the infraspinatus, not the iliocostalis,
the spinalis.
spinalis. Let's try that one. Perfect. It's a spinalis muscle. It's along the spine. All right, which muscle's that? I have to blow that up a little bit. Okay. Which one would that be?
Posterior scaling.
Posterior scaling. I would tend to agree with you because here would be the anterior, here would be the middle. Your levator scapula is right here. So I would say that'd be the posterior scaling. So it looks like, yep, perfect. And this one here. This muscle here comes across here, then slings up here. So there's two parts of this muscle. You can see them connected. We blow it up a little bit bigger. You can see this part of it connects here and then slings up to this part of it. So let's go back to the answer so you can see them. Yeah. Here we go. It would be
The gastric anterior belly.
the gastric anterior belly. This would be the gastric posterior belly right here. We see coming up after the constriction point here. The gastric anterior belly. 17. The action of the highlighted muscle is doing what? Okay, what muscle is that, first of all?
Orbicularis oris.
Orbicularis oris, right? Round string muscle around the mouth. When that muscle contracts, what happens?
Hissing.
Yep, it contracts the muscle around there. I would say it makes a hissing motion. Brings your lips together. There you go. Good. What is the function of the highlighted muscle, which Elvis Presley often used in his facial expression? Okay.
Elevating the corners of
Corners
the
of
mouth
the
into
mouth into a smile. Jinx.
Well, look where the muscle is. Does the muscle connect to the mouth at all?
I
He
can't
would
really-
always raise his one side, so just going off what you said.
It's lifting
Right? But it connects to
upper
the,
lip
it connects to the nasal. How about closing the nostrils? That would be my guess, but I'm not 100% sure. Nope. Lifting the upper lip into a snarl. I don't quite see how it would do that because if it contracts, I guess it would contract only one side. So I guess it lifts the upper lip into a snarl. You have to see how far it goes down into there. Okay. 19. The highlighted muscle rotates which joint?
The atlanto-occipital.
The atlantoaxial joint? There it is, atlantooccipital joint. No, the atlantoaxial joint. I think we'll turn it down because remember this is the axis right here. So the atlanto and the axial joint, the axis. This is the spinal process of C2, and C2 is the axis. So it's the atlantoaxial joint. And 20. Okay, what is that? What is the action of the highlighted muscle? Okay, that's what muscle is that? We should all know that muscle.
Temporalis.
Temporalis. Okay. What does the temporalis do? Does it stick out the mandible, open the jaw, compression of the cheek, or closing the jaw?
Closing the jaw.
Closing the jaw is one of the muscles that close it. The masseter and the temporalis are two muscles of mastication. They close the jaw. Very good.